Welcome to Health and Hygiene. In today's video, we'll discuss how to monitor glucose levels during pregnancy, an essential practice for expectant mothers, especially those with gestational diabetes. Monitoring glucose levels is crucial during pregnancy to ensure both the mother and the baby stay healthy. High blood sugar levels can lead to complications such as gestational diabetes, which can affect the baby's growth and development. Let's start with the tools you need: a glucose meter, test strips, a lancing device, and lancets. These are essential for checking your blood sugar levels at home. Step 1. Always wash your hands with soap and water before testing. This ensures that your test results are accurate and not contaminated by any substances on your skin. Step 2. Insert a test strip into the glucose meter. Each meter might have specific instructions, so make sure to follow the manual provided with your device. Step 3. Use the lancing device to prick the side of your fingertip. It's less painful than the pad of your finger and provides a good blood sample. Step 4. Gently squeeze your finger to get a drop of blood and apply it to the test strip. The meter will then display your blood sugar level. Knowing your target glucose levels is important. Typically, fasting blood sugar should be below 95 milligrams per deciliter. 1 hour after eating should be below 140 milligrams per deciliter, and 2 hours after eating should be below 120 milligrams per deciliter. However, always follow the specific targets set by your healthcare provider. Step 5. Record your results in a logbook or a tracking app. Keeping a detailed record helps you and your healthcare provider understand your patterns and make necessary adjustments. Regular consultations with your healthcare provider are crucial. They can review your records, adjust your treatment plan, and provide guidance on managing your blood sugar levels. Managing glucose levels isn't just about monitoring. It's also important to maintain a healthy diet and exercise regularly. Focus on balanced meals that include whole grains, lean proteins, healthy fats, and plenty of vegetables. Fruits, especially the sweet ones, should be taken after consultation with your healthcare provider. Having a support system can make a big difference. Family and friends can help you stay on track with your monitoring and lifestyle changes. Monitoring glucose levels during pregnancy is essential for your health and your baby's well-being. With regular testing, a healthy lifestyle, and support from your healthcare team, you can manage your blood sugar effectively. Thank you for watching Health and Hygiene. Don't forget to like, share, and subscribe for more helpful content. Wishing you and your baby the best of health.